definition of bladder cancer is cancer that forms in tissues of the bladder, otherwise known as the organ that stores urine. Most bladder cancers are transitional cell carcinomas, or cancer that begins in the cells that normally make up the inner lining of the bladder. Other types include squamous cell carcinoma, cancer that begin in thin, flat cells, and other carcinoma cells. Certain risk factors to develop bladder cancer is the environment which you live in and the foods in which you eat. The most common symptoms of bladder cancer include blood or blood clots in the urine, pain during urination, urinating small amounts frequently, or frequently urinary tract infections. Symptoms that may indicate more advanced bladder cancer include pain in lower back, around the kidneys, swelling in lower legs, and a growth in the pelvic near the bladder. The way to detect bladder cancer is through 6 methods. One is the physical exam, urine test, cytoscopy, MRI, ultrasound, or CT scan. In a physical exam, your doctor may conduct a physical exam and ask you about your health history and your family's health history. For a urine test, your doctor may order a urinalysis to check for cancerous cells in the blood of the urine. In a cytoscopy, during this procedure, your doctor will insert a light tube through the urethra to examine the bladder. In MRI uses imaging technology using radio frequency waves to create detailed cross-sectional images of the body. Ultrasound uses sound waves to detect section of the body, and a CT scan uses many X-ray images to show detailed images of soft tissue organs so that your doctor can assess how to best serve your needs.
Some surgical ways to help treat bladder cancer is to remove the tumor on the bladder, to remove the small portion of the bladder, or to move the bladder entirely. Another popular way to treat bladder cancer is the use of chemotherapy. Chemotherapy uses drugs to kill cancer cells. Chemotherapy treatment for bladder cancer usually involves 2 or more chemotherapy drugs used in combination. Drugs can be given through the vein in your arm, or they can be administered directly to your bladder by passing a tube through your urethra. This is the 5-year survival rate for each of the 5 stages for bladder cancer. Stage 0 is 98%, Stage 1 is 88%, Stage 2 is 63%, Stage 3 is 46%, and Stage 4 is 15%.
For an interesting fact about bladder cancer, cancer of the bladder is the 4th most common cancer among men and the 9th most common cancer among women. There are about 55,000 new cases yearly, with approximately 9,000 deaths per year in the United States.
3 out of 4 people diagnosed with bladder cancer are men between the ages of 45 and 80 years old.